Well, coronavirus cases in Arizona keep rising. The state health department says 3,638 new cases were reported just within the last 24 hours. That takes our state total past 295,000. And we are inching closer to the grim milestone of 300,000 cases. Keep in mind, these are the kind of numbers that we haven't seen since the summer. Sadly, 30 Arizonans died from COVID complications. And that means 6,457 Arizonans have lost their lives since the start of the pandemic. So as we see this surge in COVID cases, Arizona hospitals are making the switch back to no visitor policies. Starting tomorrow, Banner Health will not allow any visitors except under special circumstances. And beginning Monday, Mayo Clinic, Valleywise, and Honor Health will also enforce their no visitation policies. Starting Monday, Sky Harbor will have testing available for travelers. You can look for it over at the Drugs and More. That's in Terminal 4. It'll be open Thursdays through Monday, 9 to 5. They're expecting people to be in and out in about 20 minutes. So we asked Sky Harbor how much would this cost. They say they'll have an answer to us by Monday. Tucson started its testing as well, but their results take longer, about 72 hours.
It's now 8:35. The battle against coronavirus rages on. At least 3 vaccines are now showing significant promise. Pfizer is asking U.S. regulators to allow emergency use of its vaccine that it says has been 95% effective in tests. Moderna and AstraZeneca also have vaccines in the final stages of testing. There's been so much talk about vaccines and when we might see some available. Has Russia beat us to the punch with one? Would some people even trust getting the new vaccine? And when might we see any kind of vaccine for the public? Well, now there is a group of doctors getting together to try to keep track of all of this. One of them joining us this morning. This is Dr. Sam Sun from Endemic. Doctor, you're also investigating some of the treatments that might come out soon. So, Doc, tell me a little bit about this group that is overseeing.
Sure. So we're not overseeing anything, but we are an independent nonprofit foundation, a team of scientists, physicians, and epidemiologists independently looking at the data that's coming out on vaccines and treatments for COVID-19.
And then what are you doing with this information?
We are alerting our mailing list, which consists of medical professionals as well as industry professionals.
What are you thinking about a vaccine? Is there one you like more than others? And how soon could we see treatments?
Yeah, I know that there is always a lot of comparison of different vaccines, whether the Moderna vaccine or Pfizer vaccine is better. But at this early stage, both are very effective, both are very safe. And more importantly, in the first couple months after vaccine approval, I imagine there will be a limitation in supply. So really, both are very effective, and everyone should feel very comfortable getting either vaccine.
Many people do not feel comfortable getting a vaccine that they feel may have been rushed. What do you say to those people?
Right. It's interesting because if the vaccine trials had taken many years and waited until everyone had been infected, then I think there would be very different criticism. And on the other hand, healthcare is extremely regulated, and vaccine development is really no different. So we really have a lot of eyes on the data from all of these vaccine trials. They've been run in a very transparent manner. All the protocols that describe exactly how the studies are conducted are available online, and they've already been tested in tens of thousands of participants. So the data is very good, and the way that they've been run has been very scientifically rigorous.
What about the treatments or any possible new treatments we may be seeing for COVID-19?
Right. I would say that the most promising treatments that should be coming down the pipeline are the antibodies, neutralizing antibodies against the SARS-CoV-2 virus. They were made from the convalescent plasma of patients that had recovered from COVID-19 and engineered in various ways to make them even more effective. And we see from Lilly and from Regeneron that their data is very strong in reducing hospitalizations and reducing symptoms in outpatients who have COVID-19.
You and this group of doctors, you're looking into these different studies. Where can we learn more about what your work and what you are finding?
Right. So anyone can sign up at our website, which is endemic.org. You can sign up for our mailing list and read some of the longer perspectives that we've written on some of the controversies around aspects of COVID-19 vaccine and drug development, including some of our thoughts on remdesivir, IL-6 inhibitors, and obviously the mRNA vaccines as well.
Doc, thank you so much for your time this morning. We appreciate you. Thank you for your work.